A pansystolic murmur, which is heard at the lower left sternal edge and increases on inspiration, is typical of tricuspid regurgitation. When this murmur occurs in an adult with right atrial enlargement and a right bundle branch block, it suggests the presence of Epstein's anomaly of the tricuspid valve. Listen to a patient with tricuspid regurgitation. This murmur is due to a malformed tricuspid valve, which is displaced downwards into the right ventricle. As with most right-sided lesions, this murmur increases during inspiration. Notice the respiratory variation of this murmur. The diagnosis of Epstein's anomaly is often made by two-dimensional echocardiography, which shows the displaced tricuspid valve and the atrialization of the right ventricle. In addition, an atrial septal defect is often discovered accompanying this anomaly. The atrial septal defect in Epstein's anomaly can cause right to left shunting if the right atrial pressure is high enough. Patients may present with cyanosis or even paradoxical embolism. Older patients with Epstein's anomaly may present with a decline in exercise tolerance or an arrhythmia. Cardiac decompensation often develops with the onset of atrial fibrillation. In addition to atrial arrhythmias, up to half of patients have electrocardiographic evidence of bypass tracts, which can precipitate tachyarrhythmias. Some patients may have multiple bypass tracts, which can require ablation for control of the arrhythmia. Patients with severe symptoms, despite medical therapy, are candidates for corrective surgery, including tricuspid valve repair or replacement, and closure of the atrial septal defect. In certain patients, the atrial septal defect can now be closed percutaneously with an occluding device if the anatomy is favorable and the proper precautions are observed. In summary, adult patients with Epstein's anomaly may present with a pansystolic murmur of tricuspid regurgitation. Patients may experience a decline in exercise capacity, atrial arrhythmias, or cyanosis. Repair of the tricuspid valve and closure of an atrial septal defect are indicated in symptomatic patients. Listen once again to the pansystolic murmur of tricuspid regurgitation.